Hello, my name is George Rojas, and I am a student at Kaiser University Fort Lauderdale campus in the Masters of Science Occupational Therapy program. Now, today's video will discuss what an interdisciplinary team is, what I learned about an interdisciplinary team, what the role of an OTR is in the interdisciplinary team, and in my current workplace, some areas of concerns regarding this interdisciplinary team, and some suggestions and strategies to improve these areas. Now, to begin, what is an interdisciplinary team? Now, to me, an interdisciplinary team is consisted of individuals not necessarily limited to healthcare professionals that are essential in the provision of quality of care for a patient or client. Now, what did I learn this week about an interdisciplinary team? Is that effective communication strategies, accountability, and commitment among all the team members are necessary in order to increase patient engagement and overall functional performance. As an OTR, what is the role in the interdisciplinary team? Is to provide effective and necessary documentation, including evaluations, assessments, and therapy notes if you saw the patient. Also, to provide effective supervision for any CODAs under your supervision, and keeping up to date with the patient's progress, so that if you ever need to reevaluate that patient, it doesn't seem like that you're not aware of how they are, who they are, or that you don't care for them. Now, in my current workplace, some areas regarding the interdisciplinary team would be in regards to, I would say, documentation. Now, there has been some issues that I won't go too into detail about it, but when it comes to documentation, documentation has sort of been limited to certain people because of that issue. Meaning, if I see a patient, I do have access to the plan of care and the evaluation, of course, but I might not be able to see other therapists' notes because of a certain issue that's been going on. Now, some suggestions or strategies that I would have are to perhaps maybe allow or ask for access in order to see that those documentations, because not seeing that documentation could hinder the overall therapy session, because I might be seeing a patient for the first time, or I might be covering for someone and I don't know how that patient works, and I could view someone's notes to see what they used, what they did, what they didn't like, perhaps. And yeah, but otherwise, in the current workplace, we have a WhatsApp chat that works very well. We talk face to face almost every hour, because we're constantly rotating patients, and we talk amongst each other about what worked, what didn't work, and so forth. But sometimes you come in and you sit at your desk and you have a patient right away, and you want to look at notes, and you're not able to. You're only able to look at your own notes, which could be an issue. So that concludes today's video. Thank you very much.